Hi, I'm Dr. Satish Nair. I'm an ENT and head and neck surgeon. I specialize in minimally invasive endoscopic and robotic surgeries of the ear as well as the head and neck pathology. A common condition that many women have is a thyroid swelling. Swellings in thyroid or nodules in thyroid are pretty common in women because the requirement of the hormone during various phases of the month and through the life with pregnancy, etc. They can cause some amount of fluctuation leading to changes and nodule formation. Whereas formation of nodules or things in men are very rare. So 95% of the women who have thyroid nodules are usually benign conditions. So if I take a group of women at the age of 50 and do ultrasound, 50% of them may have nodules which are less than 1 centimeter, nothing much to be done. But usually it's not seen in males. Whenever they have, there's a high chance of that it can be malignant. Thyroid conditions are usually treated medically. Way I say medically is that are usually on observation. So if you have a person who comes with a thyroid nodule, instantly found on ultrasound, instantly found by that, or just they feel a small swelling, you do evaluate them. The evaluation by looking at the hormone levels. If there's increased hormone levels, you can have an increase in size. If you have decreased hormone levels, again the gland can increase. But most of them may have a normal hormone levels, but still have a nodule in the thyroid. Less than a centimeter nodules are usually not even evaluated further. If it is more than a centimeter, maybe you do go through an ultrasound evaluation, or maybe even in the ultrasound, if it gives some features just suggestive of malignancy, a fine needle testing is done to evaluate it. Every thyroid swelling does not need to be operated. So who does need a surgery? Thyroid surgery is needed in those people, definitely needed in those people. For example, when you test them and it comes as cancer, so they do require surgery. Or it comes suspicious for cancer, second group of people. Third group of people are those who are hyperthyroid on medication, but with medication they are not able to control themselves. After a time it happens that they are not able to control, so you do go and do a thyroidectomy to reduce the hyper or the increased hormonal levels. Fourth group are those people who are usually having very large thyroids. The thyroid can grow in the neck, it can also grow toward the chest, pressing on to the various structures. So the foot pipe and the windpipe are there, it can cause pressure. They're called pressure effects. So when you reach a stage where you say there is chance of pressure effects in the patient, so those patients also do classify into the area of going for thyroid surgery. So these are the general areas where I would say a thyroid surgery is something which I would tell the patient that you would require. The other question that usually patient asks is, Doctor, I heard there's a mini thyroid surgery or no scar surgery. Thyroids cannot be removed without scar. There has to be a scar somewhere. Yes, there are transoral methods to do it, but not for all cases. They have specific indications. So instead of the typical scar which we do it here, a small cut here and remove thyroid, which is the classical one described for many centuries and being done, you can shift the scar somewhere here, back of the ear, hairline, or towards your axilla, or put ports through your use an endoscope or a robo and get it done. But then you have to open up somewhere. It's not scarless, but there would be scars somewhere. This is called generally remote scar surgery. So both endoscopic and robotic surgeries can be performed, usually done for people with a volume or the size of thyroid which are small, less than 3 centimeters, a benign condition, usually not done for malignancy. But then there's always some amount of extrapolation of these indications, and people do perform. But then that's the general idea of thyroid. So again, coming back to the original thing, most of the thyroid nodules do not require to be operated. So please do not get scared when you have a thyroid nodule immediately that I need to get surgery to it. No, you do definitely need to get yourself evaluated. Once you're evaluated, you should be content and you should be relaxed on the fact that there's nothing there. It's just a nodule that has developed, and yes, we can keep it on observation. Thank you.